are they doing more harm than good by pushing through an injury? If it's an acute strain and it's just a matter of pain tolerance, then they might be able to play through that. But if we're worried if it's a torn muscle and they're going to do more harm by continuing to run on it, the tear might get larger. In the long run, it might mean more significant recovery.
Sure. I mean, in terms of getting athletes back in the game, obviously the overriding principles are the same. You want to make sure they're healthy, they're pain-free before getting them back. I think, but when you're comparing Olympic athletes versus weekend warriors, the time frame is what's going to change. These are Olympic athletes. These are the best conditioned athletes in the world. There's something that made them different to begin with biologically to get them to compete at that level. So to compare myself to them, and wonder why I'm not getting back as quickly after an ankle sprain or an injured shoulder is naive on my part. But I think it again gets compounded, and the difference becomes more glaring because these guys are getting, access to the best medical care in the world around the clock. So I'll see somebody in my office. They'll go to physical therapy twice a week. Whereas these athletes are getting physical therapy, 8-10 hours a day for the sole purpose of getting them back to their sport.
An athlete that has a lower extremity injury, you can use things such as the pool to keep the training up. If it's lower extremity, you can use an upper body ergometer